here's what's happened. This tends to happen in an acupuncture session. And when I first moved here, I was actually surprised that I would have to tell people what happened in an acupuncture session. I just figured, Portland, Oregon, everyone's gone to an acupuncturist. Everyone's totally familiar with this. And it's not true. So a regular acupuncture session tends to consist of two major parts. The first part is a conversation. That's something that you really tend not to get with a biomedical practitioner. You don't get to have a conversation. But acupuncture is treating an entire person. And so we can have, as part of the therapy, in fact, a conversation about where that person is, what's going on with them, how things have changed. So that's one half of the therapeutic session. And the second half is the acupuncture itself. Given the information that I've gotten from that conversation, I will pick a treatment pattern. Usually I actually improvise it as I go along. That's one of the wonderful things about this practice, is that it's almost like playing music, that I have a general idea of what I want to do when I start, but I'll never know for sure which points I'm going to use, what combinations I'm going to use, until there it is, there's the pattern. So that part consists of needling a person. I tend to use very few needles compared to some other practitioners, 5, 10, 15, that's kind of a high number. I put those needles in, person just rests with them doing what they do. It's not magic. For about 15, 20 minutes, I come back, needles come out, and then we see what happens over the next week, 2 weeks, until I see them again.